What inspired me to be a pediatric physician was when I was a medical student and I had no clue on what I was going to do. I was kind of wide open to suggestions, and I just happened to meet a 3-year-old girl that had kidney problems on my first day of my pediatric rotation. And it was such fun taking care of her, even though she was seriously ill. She made every day a joy, and I just realized who wouldn't want to take care of kids? You know, even at 6 in the morning, they're glad to see you usually. So it was a pretty easy choice after I met her. What I love most working with children is a couple of things. A is they generally have unlimited potential, and we can hopefully impact them early in life so that when we're doing our well checks or preventive care, we can strengthen their families and their own self-confidence to have successful outcomes in school, in life, and sports. Or even if they're sick, we can generally make improvements or interventions before permanent damage has been done. And it's often a shame when I hear about older patients that have severe heart disease. Maybe they have a history of smoking and their lungs are shot. And we often say it's a shame that nothing can be done now. So really in the end, I think a lot of us are in this field because we want to prevent the disease to begin with. The thing I am most proud about Mercy Children's Hospital is its mission. And as part of all of Mercy, that we will take care of anyone, regardless of who they are and their ability to pay. And that the community can always count on Mercy Children's to be here. And at the same time, it's not just any hospital, but it's the best place to get pediatric care in Northwest Ohio. And we have a combined mission of education, practice of pediatric state-of-the-art evidence-based medicine, as well as research. I choose to support the hospital with my giving because I know it goes to a terrific use. I can't think of anything better than giving back to the institution that takes care of so many of our most vulnerable children, and they need it. Pediatrics does not bring in the money. You know, many people think that doctors, hospitals make money all the time. There are some specialties that can bring in the money to support a hospital. Pediatrics generally isn't one of those that can do that. They often rely on government assistance, charity, as well as the donors, people that are watching this kind of program. And without that, we couldn't do our mission. So it's really, in essence, if I'm going to ask people to do that, which I am today, then I certainly want to, live up to my own expectations and give as much as I can. I hope others will make a gift to Children's Miracle Network and support Mercy Children's, because you never know when you may need it. And even if you don't need it, someone you know probably will. And we wish we didn't have to be here, but health care and disease is part of the human condition. And at least if that's going to happen, at least there's a place like Mercy Children's, and we desperately need support.